The Manitoba Dental Association wants to do its part to reach truth and reconciliation in this province. The Truth and Reconciliation Commission report recommended finding ways to consider Indigenous culture and customs when providing medical and dental care. Part of that mandate would include sensitivity training for new and existing dentists. Joining us now from the Manitoba Dental Association is Dr. Alan Grant. Good morning, Dr. Grant.
Good morning.
Thanks so much for joining us.
My pleasure, sir.
Now, some of these, tell us about the Truth and Reconciliation report and the mandate that it called for and how the Manitoba Dental Association stepped in to bring in some of those new changes.
Yeah, well, we have to thank the Honourable Murray Sinclair for his work on that, and we kind of think of it as just a continuation of his work, and I think that with the election of Wab Kinew, and it's been a very, I think, almost a pendulum swinging, and I see a lot of organizations willing to break down these stereotypes and forward the agenda of Murray Sinclair and his Truth and Reconciliation Commission action plan. So that's our goal, is to forward those agenda items from his specifically the ones that relate to medicine and dentistry, and the Manitoba Dental Association, and we have a partnership with the University of Manitoba to forward that agenda and to make things more equitable in terms of patient care and understanding where they're coming from.
Yeah.
Trying to break down basically stereotypes and those kind of things, and just bring Indigenous people into the process. You know, to get a better education, to be part of a solution to make their healthcare better. And the Manitoba Dental Association is providing some training, cultural sensitivity training, and the University of Manitoba is also doing that. So we want to educate the new students with a bit better cultural understanding and awareness of their practices. And reconciliation is not about kind of making people feel guilty about things. It's about recognizing the past and trying to make things better today.
Mm-hmm. And so you've been doing this for about 1.5 years already.
Yes, yes.
And so how has it been sort of coming along?
Well, it's a slow process because we have a big group of people with elders and different stakeholders. Like we have First Nations, Inuit, and Métis representation. We have other board members that are others like stakeholders, myself included. I am also of Indigenous background. My mom is Aboriginal, so I consider myself Métis. But my mother's family was removed off the reserve a long time ago. But we ended up getting status back afterwards, and so. I think I'm kind of a hybrid person. I'm kind of in both worlds, and I feel like it's a great opportunity, and I really feel strongly about helping bridging this gap and helping this reconciliation process move forward, because I know personally that a lot of Indigenous people are misunderstood, and they need this as a healing to get through and break through to another level and to become active members of society, and they need some help. And so the university has partnered with us to increase the number of students accepted Indigenous students accepted into the University of Manitoba, and to accept their cultural practices as being valid and important, and then supporting them through a mentoring program afterwards to get them through. And for us at the MDA, like once those students become dentists, we want to support our dentists to also take that cultural training if they hadn't had it while they were in dental school. And we want to provide our membership with the ability to also understand where things are coming from, not to make anyone feel guilty about what's happened in the past, but to just understand why there's high levels of poverty, why there's high levels of mental illness and maybe drug abuse, and why it's happening. And it has to do with what's happened through that residential school programs, and that was all sort of brought forward by Murray Sinclair and the Truth and Reconciliation.
Right. Well, thank you for sharing this with us. Of course, if you want more information, we do have a link on our website. Thank you, Doctor.